going to close this door to provide privacy, and then I'm going to wash my hands. Good morning, Miss Teddy. My name is Abby. I'm going to be your nurse today. So the doctor ordered us to do an indwelling urinary catheter, and that simply is putting this small little tube up your urethra, and then it helps you urinate, okay? So the first thing I need to do is just check your ID. And can you give me your name and date of birth? All right, perfect. Those look like those match. And before we go any further, you're not allergic to iodine, betadine, alcohol, latex, anything like that? No, perfect. Okay, so what we're going to do first is I'm going to roll this back. And we're going to put this blanket over here so we can see me do this. All right, perfect. Now we're going to pull your gown up to expose you a little bit. And then I'm going to have you bend your knees. All right, perfect. And just lay your head back a little bit. Perfect. All right. So now I'm going to set my sterile field up. All right. And before I do anything there, looking at her perineal area, it doesn't look like she needs perineal care, but if she does and it's looking like a little dirty or anything, we would do that. All right, now we're going to set this up. I'm touching the 1-inch border. All right, and then come over here. All right, perfect. And just straightening that out with the 1-inch border. I'm going to take my sterile gloves and set them right there. Now I'm going to take the rest of this stuff, throw it over there, coming around me so I'm not moving over my sterile field. Now I'm going to take the bedding cover to catch any excess fluid and set that down by touching the little ends of it, just a 1-inch border. And then if I need to reposition it, I'll go over her and up under her leg to pull it through. All right, perfect. Now, obviously it would be this close, I just don't have a lot of room. All right, now that we've got that done, I'm going to put my sterile gloves on. You can see me. All right, open that. I'm only touching that 1-inch border. Again, obviously none of this would be touching, but I don't have a lot of room. All right, now with my dominant hand, I'm going to go up into the glove. Not touching the outside of it because that's sterile. So only touching the inside like this. I'm putting my hand through and pulling that down as much as I can. All right, now with these 4 fingers, I'm going to go up under and lift the glove up. And then I'm going to put my hand in. Okay, perfect. All right, we have my sterile gloves on. Now I'm going to scooch my box over a little bit and take this lid off and set this right here. The first thing I'm going to do is take my lubricant and I'm going to put it in the corner. Then I'm going to come around me to not break my sterile field. Then I'm going to take my iodine or alcohol swabs and set them in the corner. Come around, drop that like a bomb. And now I'm going to attach my sterile water to this. Around, drop that. All right, perfect. Now I'm going to take the covering off my catheter. While wrapping it around my fingers to avoid it flying and becoming contaminated. All right, perfect. Now come around, set that right there. Now I'm going to stick the end of my catheter into my Vaseline. Put up a stay. All right. Now I'm going to bring my box to the bed covering. Now, Miss Teddy, when we do this, you're going to feel slight pressure, and I just need you to bear down. Okay? Now, the first thing I'm going to do is clean her vaginal area with the alcohol or iodine swabs. I'm going to take one alcohol swab, and with my non-dominant hand, I'm going to spread her labia. And I'm not going to remove my hand until I'm completely finished. Now, on the outside, now go around, drop it like a bomb. I'm going to get one more, closest to me, go around, drop it like a bomb, get one more, straight down, drop it like a bomb. Alright, now I'm going to keep my hand here. Now I'm going to take the end of my catheter, and without touching the vaginal area, I'm going to thread it through the urethra. Now, you will feel pressure, okay? And I just need you to bear down. And I'm going to keep threading until I see urine. Oh, I see urine. Okay, now for females, you're going to do 1 to 2 inches more, and for males, you would do 3 to 4 inches, and you would have to do 3 to 4 more inches with males because they have a a prostate, and you have to go around that. 1 to 2 inches more. All right, perfect. Now, before I fill the bubble up with sterile water, I must take my non-dominant hand, and since the catheter isn't going anymore, it's anymore, it's no longer sterile, or on the outside it's not sterile, it'll be okay. So I'm going to take my non-dominant hand and hold this, and then I'm going to fill my bubble up with sterile water. Alright, now I'm going to do a slight tug. I have resistance. It's not coming out. Perfect. Now I can let this go. And moving up the syringe, pop that out. Come over here and drop that. Now, since I have vaginal fluid and everything on my hands, I'm going to take my gloves off and change my gloves. Now, after I've changed my gloves, I'm going to attach the stat lock to the patient, and then I'm going to take the bag, and I'm going to hang it on the bed frame, not the bed rail, a non-movable part of the bed. And then while I'm doing that, I'm assessing the catheter bag and assessing the urine, the color, how much it is, and consistency, and if there's odor. It looks like there's 200 milliliters, it's light yellow, it has no odor, and no sediment or anything in there. So I'm going to attach that. Now, after I've done all that, I'm going to come back to her perineal area, and I'm going to look at that and see if she needs to be cleaned. Of course she does. She has vaginal fluid. She has lubricant all over her. So I'm going to clean her vaginal area, and then after I do that, I'm going to provide dignity for her. I'm going to pull her gown back down with new gloves, obviously, and then I'm going to cover her back up. All right. Days later, it's time for Miss Teddy to go home, and the doctor is wanting us to remove the catheter. So he put an order in for us to remove the catheter. Good morning, Miss Teddy. I heard you're going home soon. The doctor has put in an order for us to remove your catheter, okay? So, now, what we're going to do is we're going to first remove the stat lock. Okay, we're going to remove the stat lock. Stat lock's been removed after we put new gloves on, clean gloves. And then we're going to pick the catheter bag up, and we're going to assess the catheter fluid. We're going to assess the urine in the catheter. It looks like it's at 800 milliliters. It's pale yellow, no sediment in it, and doesn't have an odor. And then we're going to empty the catheter bag. After we do that, we're going to get our sterile water, and we're going to remove the bubble in the catheter. Alright, you're going to feel a slight bit of pressure again when I pull this out. Now, while pulling this out, if I feel any resistance, I'm going to again see if I have, I'm going to go back with the syringe and pull to make sure there's no more fluid in that, because we don't want to rip a catheter out that still has a bubble. So we're going to pull. Okay, cup's coming out. We're going to pull. Okay. Now, I'm going to assess the tip. There's no blood. The tip is intact. You can relax, Miss Teddy. We're all done. I'm going to set all this down. After I'm done with that, move that out of the way. Now, we're going to provide perineal care again. And then we're going to cover Miss Teddy back up. Get her covered back up, and then get her ready for discharge. Change my gloves, wash my hands, do all that good stuff. All right. That's how you place a catheter and remove it.